Samira Ben Omar. Welcome to Samira, who I first got to know not so long ago, actually, following one of the really fun conferences led by the Nuffield Trust. I think it was a couple of years ago, where I had the audacity to ask the question, what does anybody, for goodness sake, means by the idea and the word community, which then generated a lot of very fascinating coffee conversations, Samira. So welcome, over to you.
Thank you. Thanks for that general introduction. And yes, we have met 2 years ago at one of the Nuffield Trust Summits where I was presenting around kind of community perspective. So thanks for the invitation and thanks for allowing me to share with you some of my thoughts and experiences on this. And just as an introduction, I worked in the NHS and in local authority for over 20 years, 22, 23 years, and I've only been working independently for 3 years. So, and it's very much working on the in the area of the EDI agenda, the health inequality, the public health, and working on community engagement and community mobilizing around health inequalities. And I've always occupied the space between system and community, and I think it's that space. I used to call it a tightrope, walking a tightrope between system and community, and now it's more of a chasm, and that's a good thing. And that space is very much around, if you go to the next slide, that space is very much around actually kind of bringing two different structures or ecosystems together. So if you like, the public sector structure, which is hierarchical and transactional, and the community structure, which is very much relational and emergent. So the idea is, how do you bring the two together, the two systems together, and how do you facilitate that space and nurture that space to actually kind of create something that kind of speaks both to the community and the system. And I think for me, it was just about, and so that's where the community voices as a social movement approach actually kind of began to emerge. It emerged especially during the COVID, and really kind of beginning to collect stories for change and really connect different youth communities. But prior to that, it really kind of began to emerge in the aftermath of the Grenfell fire disaster. And that was really beginning to think about, we need something different, and we need to think differently, and we need to think differently about leadership and connecting differently with communities. So the approach is very much about really kind of thinking about shifting from a structured approach to investment in relationships. So your starting point is about the conversation that you have, and you connect differently with your communities, your patients, and your frontline staff. The second is actually, it's not just about the policies and the strategies that we have in place. It's how do we ensure that the power belongs to the voices that we hear, and that we are ethically accountable to ensure that we don't translate it and interpret it in the way that actually satisfies the system purposes rather than the community services. So how do we negotiate with our communities so that it's managed in an open, transparent way? And it's actually kind of about building a trustworthy relationship with people. And I don't want to say trust or building trust. It's about the trustworthiness of actually the commitments that we bring between systems and communities. And it's about actually challenging each other. So this is about actually being able to be system challengers and stimulate wider conversations. And so it's not about challenging for challenging sake. It's about challenging to really push both the system and the community together around creating a shared purpose and really kind of connecting differently together, but also holding each other accountable for the actions that we do. The third, it's about moving, so inviting people within organizations and people within communities to step outside of their organizational and community boundaries to occupy that space. So this is an invitation. This isn't kind of a mandate that you have to work together. It's an invitation to really work together to address the challenges and to make sense of the challenges. To do this really well, you really need to actually kind of think about some unlearning, because we're all institutionalized in the way we think. We've all been trained to think in a different way, to use different tools, and to actually kind of manage things in a structured way. So how do we unlearn and recognize some of the system limitations and some of the community limitations to enable us to actually do that? And that requires, so it's not just the unlearning, is once you began to unlearn, you need to actually really think and rethink about how we collectively make sense of the challenges together that exist, and then thinking about the solutions that emerge. If you go to the next slide. So what is community voices? Well, it's about the people. It's about the people in the system and the people in the community. And these are some of the people that I've worked with. You've got Robin Duran, who was the chief operating officer at one of the mental health trusts, who led on the Grenfell Aftermath. And it really kind of then you began to actually kind of really think about what leadership looks like. And one of the stories that I'll never forget was I led on the engagement from the system on Grenfell before, and I asked Robin, what is it that makes you want to step into that space? And she said, well, I've just come back from my sister's funeral, so I'm grieving, and the community are grieving, and we're grieving together. And that puts me in a different place, time, and a different space. It's about actually connecting to those stories with the people. Then there's the kind of young people that we worked with. I'm really kind of thinking and sharing their stories. There's Chad, who's a GP and who's a clinical lead at one of the GP practices, who sets up a whole social movement around actually GPs at the deep end. And now he calls it just the deep end because he said it's more than GPs, it's community. It's connecting with Fatima, who's a survivor. You know, his family are kind of the last family out of the life of Grenfell. Justin, who was a drug and alcohol user from the age of 14 to the age of 44. And he said, I want to give back, but I want to do it on my terms, and I want to work with you, connecting with different. So this is about actually kind of how we create and generate the space for a different type of conversation to really enable us to really kind of affect the change that we want to see. So what does that look like, and how does that actually kind of help us to do? What are the conditions or preconditions for really kind of doing that? If you go to the next slide, and this is just kind of some of the, this is just a drawing of a session that I was facilitating probably about a year ago. And it was those frontline staff from a community provider and an acute trust, as well as people from the community. And it was just all frontline staff and community organizers. And we really kind of began to think about what are the issues. And it was not surprising to many of us. The issues around addressing health inequalities are very similar. The frustrations of frontline staff are very similar to the frustrations of community. There's too many barriers. The community, confusing and difficult systems. You know, everything is reactive. I'm not sure why we have to implement this, but we have to we've been told we have to implement this. From the community perspective, nobody understands that actually it's a DNA. I did not turn up for that appointment because I've had kind of challenging issues at home. I've got a housing issue, all of those things. So the idea was actually kind of, if they're kind of the challenges of our system through the lens of our frontline staff, and the challenges of our community through the lens of our communities are very similar, what is it as a system that we need to do to really kind of address some of this? And there are kind of four things that kept coming up. The first one was actually, we really need to understand that communities do more when they decide for themselves. Health happens in communities. It doesn't happen in our hospitals. Treatment happens in our hospitals. So how do we work with our communities to stay healthy, but in their neighborhoods, within their families, how we do that? The second is actually kind of community and safe spaces are the lifeblood of local action. How do we invest in that? How do we grow that space? And how do we work with that? We've seen it during COVID. I've personally seen it during the Grenfell fire disaster. The first port of call was your own community. I think some people have said, certainly to me, that Gold Command, when COVID happened, started in the community. They were the people knocking on doors, identifying us well before Gold Command started in our system. So how do we grow that? How do we invest in that? The third one, and especially kind of just given the current climate, is that racism, not race, racism has a negative impact on the health of our communities, and we need to be proactive and acknowledge that. It's how the system reacts to certain communities. It's not how the system actually kind of just it becomes reactive to the needs of communities. And the final one is really about measuring what people value. The NHS and the wider public sector have some amazing tools for measuring impact, but sometimes they don't speak to our communities. If we really begin to think about or unthink about the tools that we need to use and really negotiate with our system and communities, what tools we need to use to help us actually measure the impact, that will be quite critical. And then final slide. And these are just my reflections and actually kind of my thoughts. Who do we listen to? If we really kind of think as a system, who do we listen to most intently? Who do we ignore most? And how do we truly know if we don't walk our neighborhoods and we don't walk our communities? How do we truly know our communities and the way they live their lives? And I'll just stop there.
So, Samira, fantastic. Thank you for that. I've just been informed that I'm being a really poor chair with timing, so that's all on me. Can I just ask a very brief question for a brief response then? So, from Ajit, we had a very interesting institutional perspective. He called himself an institutionalist, which is an interesting perspective, and you come from the grassroots, from the community perspective. In as short a time as you can, how does one build that relationship of trust between the ideas you've shared around communities and the institutions on which we still rely on the needs that need to be met? Because it can't all sit in the communities and it can't all sit in the institutions.
Well, I think there's two things. One is it's about, I mean, the problem is trust takes a long time, but trustworthiness can start from the beginning. And it's about actually it's about really kind of connecting differently and being transparent with as the people in terms of what we commit to do and the way we commit to do them, and feeding back constantly and consistently. I think the idea is very much two things. Focus on the trustworthiness. We said we're going to do this and then we commit to doing them. And if we can't do them, then we actually kind of communicate. So there's something about acting and communicating. And if we act in terms of and the action, and we build, in terms of acting, we build accountability, we bake it into our policies and plans. If we do that, both kind of top down and bottom up, if we build it within the way we actually kind of connect differently, and then we communicate it. And again, it's about communicating and being accountable in how, and transparent in how we communicate with our communities, our patients, and our frontline staff.
Thank you, Samira.